Welcome to Care Beyond Barriers. I'm Christina Farr, and today, along with my panel, Dr. Tom Kelly, Dr. Hannah Allen, and Dr. Simon Koss, we are wrapping up this season by looking towards the future. Okay, so I'm going to start us off with a little bit of a fun, spicy provocation for three doctors, which is to bring up Vinod Khosla, the venture capitalist that I'm sure you all are aware of, a Silicon Valley legend, who said on stage and made a lot of people unhappy in doing so that eventually there would be no more doctors, that AI would replace doctors. And he said this over a decade ago at a time when not many people saw AI coming. So at the time, it was even more controversial. But I want to throw that out to the group to really evaluate the question and whether or not it's possible that this future could exist, but then also get into some of the nuances around this. And I'm going to push you all not to violently agree, even though you are all physicians. So Simon, start us off. How did you react to that statement? And I heard you got into a bit of a dialogue with Vinod about this.
I was on stage with Vinod on a panel at Precision Medicine World Summit in 2018, and he said that, and I reacted pretty strongly. Back in 2018, we didn't have foundational large language models, and the suggestion was that AGI, artificial general intelligence, was at least 20 years away. So within 10 years, all doctors are out of a job and we're using artificial agents. Just seemed ridiculous to me. And then when I saw large language models and generative AI came, it was probably closer than I ever thought it was. And the consensus is we get to AGI maybe as early as 2027, probably by 2030. This is a valid question now. But I think that even though these tools can do tasks within a role, I think the job of a clinician remains, but I think it changes. And I think we need to index on the things that humans are really good at. So I'd call out empathy, accountability, and ingenuity as three uniquely human things. And yes, parts of them can be appropriated by artificial intelligence, but even from an accountability perspective, I don't think as a society we're ready for AI to make the call, because what happens when it goes wrong? Who do you hold accountable for that decision? And so I think there's a role for humans even beyond 10 years, but it will look different.
Hannah, some people say it's going to all turn very procedural because no AI is going to be able to wield a scalpel anytime soon and do a complex surgery. So, you're a GP. I think a lot of folks out there would say AI might replace you a little bit sooner than the surgeon down the street. A, do you agree with that? And B, do you think it's true that surgery in the way that it is done today is going to continue in this form, or do you see a potential for AI there as well?
I think there are certain elements that, I fully accept and embrace that, we know that technology is far better than me in many, many ways, in kind of ingesting millions of data points and making sense of it, and supporting me to do my job better. The argument is always the human side of things and the kind of empathy and I think that technology is really supporting us to kind of give us that superpower. So, I love speaking to patients. I love hearing their stories and kind of putting my hand on their shoulder when I'm giving them an awful diagnosis, or hand holding them through these really pivotal, life moments that I think it's a real privilege to play that role as a GP. Do patients want that to be a robot doing that for them? I don't know. I think that side of kind of human medicine and primary care will be preserved for a very long period of time. And I hope that, technology will augment us to be able to kind of embrace that more human side of healthcare medicine.
And how about the surgery piece? How do you think that changed? Do you see more primary care kind of converting into surgical type professions because it feels like it has staying power?
Well, we've already got kind of robotic machines doing pediatric surgeries across the world, and seeing more success, more accuracy, better outcomes, less bleeding. Well, I'll let the surgeon talk about all of that. But I think that we'll start to kind of subspecialize into more interventional procedures, and as we shift kind of back into these community neighborhoods out of secondary care and acute care, which we have to do to sustain the healthcare system, I think we'll start to see that movement for sure.
Yeah, I think we're relatively far off. Like, we don't have robots that can put dishes away without endangering the lives of everyone in the house, and I think it's like a bandwidth problem. Like, LLMs are amazing at clinical knowledge. So we will see studies saying that, hey, we passed all the USMLEs. That's already happened. Or any clinical question that you could possibly imagine, yes, probably LLMs are better than humans at making that choice. But what's different is when you're in front of someone, you're processing videos. So, most LLMs can't cope with more than, say, like 10 images at once. But we see, let's say, call it 20, usually people say 60 frames a second or something. So like, basically we just have more bandwidth. So although maybe our clinical knowledge is slightly worse and fallible, I suspect we'll be much better at managing risk and ambiguity for quite a long time, actually. I do think that no doctor will practice without AI probably by the end of the 2020s. I don't know if we have something to say about it. Like, I think it'll feel unusual if you're 5 years from now and seeing a doctor who's not using an AI. It would be like, why? Like, we know that the AI is the best for the clinical part. We're here to see you because you're the one that orders the tests, manages the health economics, achieves other primary objectives, and is the human in the room. My favorite, there's a really good book. It's called, it's the Culture series from Ian Banks. And basically in that world, there's these AGIs that take over and become a culture. It's actually called The Culture. And then there's another group that basically reject this idea, and robots are tools and they just never go beyond it. And like any robot with a consciousness, they try to shut it down, basically. Because it takes over something that is unique about being alive and being human. And it's like a step too far. It's the same in the book June. Like, they get rid of all intelligences because they decide that is what being a human is. So that's what I think will happen. It'll be like some sort of like revolt / rejection of that model. Like, I think we will be able to do it. It's just like, is that how I want to be seen? Like, do I want to go to the robot, like the Optimus version 12 that can do any general surgery better than I can? Maybe yes, but would I want a human surgeon overseeing all the Optimi? Yeah, I think so. I'm not quite sure how to play out, but yeah, I think humans will always value being with other humans in some way. It's just maybe the job will change.
Okay, so we talked about the job changing. I want to go a little bit further and ask if there are medical specialties where it just will not be very relevant. And maybe that specialty becomes a different specialty. Walk us through some of those, where your thoughts are with some of the specialties in particular where AI, there are obviously a few that I talked about as AI potentially having the most impact.
There are specialties where the specialty is about doing diagnostic interpretation. And if you're a radiologist, you're a pathologist, even aspects of cardiology, dermatology, ophthalmology, the whole idea that you as a human would sit there and you would interpret what comes out of a diagnostic imaging machine, for example, we know that artificial intelligence can do that faster, cheaper, more accurately. But does that mean the whole specialty goes away? Does ophthalmology go away because they don't read retinal scans? Well, no, people have still got eyes. They still need medical care for their eyes. Both my parents are radiologists, and Dad has just pivoted into the procedural space, and now using the traditional medical imaging modalities, he's actually doing therapeutic procedures. An example of how the whole specialty has emerged. I'm not sure that any will go away entirely, but I think all of them will change to a greater or lesser extent.
Yeah, with radiology is kind of tricky because I think it's like caught in two different generations. So there's the 2010s generation of AI where you upload a bunch of images, you deep learn characteristics, and you build like a narrow AI that's really good at chest x-rays. But usually they're sort of dead ends evolutionarily because they don't really learn anything about the world. They're just like stuck on the chest x-ray. And the radiologist hasn't really been disrupted in those settings because if you get a mobile chest x-ray, it doesn't work, or they've stuffed up the way they took it, doesn't work. And then the health economics of it has been that it's so narrow and you're limited to like a test at a time in order to get the economic advantage, that they end up doing labeling or triaging or ordering or flagging or something they can like attach an ROI pillar to. Whereas I suspect with multimodal models, I do think those specialties are going to go away, mainly because it'll take a long time, longer than we think, to approve some of these systems. But if I see every CT scan ever recorded in Australia, and every MRI and every chest X-ray, and also the corpus of medical knowledge in the whole world, you can't tell me that system is not going to be as good as a human at picking out the signs and symptoms that are in the scan. And also, I know a lot of radiologists say, well, there's still a conversation with the doctor and the prioritization of the scan and which scan do I order and the clinical notes and reading the history. But actually, like, that's multimodal models are great at all those things. So I suspect those purely diagnostic things will go away. The interventional side, like the procedural side, probably sticks around. Same with everything else. But like, do we need that many interventional radiologists? I'm not really sure. But I know there have been a lot of famous futurists that have died on this hill making bad predictions. But I do think multimodal models will be the thing. But it may be like middle of the 2030s, like 10 years away before, because you have to do a trial on every modality and condition at scale. So quite hard to prove that your system is as good as a radiologist and an MRI brain. Like, when is the burden of proof sufficient?
So it'll take time.
A long time.
But we'll get there.
And responsibility-wise, like, to your point, where does the responsibility lie? I think that's going to be the biggest sort of challenge, barrier, question.
Like, who would underwrite it, basically, as an insurer?
Yeah.
But there's a reason why, at least in the US context, the diabetic retinopathy scan is the one thing that already has reimbursement with a fully autonomous AI making that decision about which patients need to be seen sooner. And it's a massive, massive deal for these rural areas in particular, where these patients can be waiting a really long time and they can go blind while they wait. And that's a serious problem. So I do agree with you that seems like a high potential area for AI. So if you are a medical student now, you're thinking about a specialty to move into that is more AI proof and maybe isn't a specialty that doctors are necessarily rushing to today, but you think it will be one that really comes up in the future. Any thoughts?
Clinical informatics.
Talking your own book.
Once upon a time, we didn't have a radiology department. You had these X-ray machines that everyone would use in their various specialty, and then they looked and they saw the scale and they centralized it and they got proficiency around it. The same is happening with informatics at the moment. It's distributed out and everyone's got their own specialties and ideas about what they need and what works and what doesn't, and it's a bit of a cottage industry. Clearly, technology is going to become more embedded in the way we deliver healthcare services, and that's going to require people from the inside understanding how that gets delivered. So if there's one specialty that's got a future, at least for the medium term, I think it's clinical informatics.
I don't know, weirdly, I think psychiatry, I don't know, this is like a weirdly like not common. I feel like most people think that mental health is easy.
Yeah.
Again, it's like the human factors. Like, I feel like I'm not sure that most patients who need mental health support, I know there's lots of chatbots, but to me intuitively just feels like it's not going to be enough. Like, it's always lesser than, in my opinion, than the real thing. Still great, still good. There's not enough mental health doctors, but I think to me that's like, if I think of what's the most human, that is like the most.
But what if they had like an avatar of their psychiatrist that it looked and felt like a human who was there 24/7,
like VO
coaching
3.1,
them,
like simulating a video. I don't know. I feel like you'd be able to see that it's thin. like there'd be like some missing soul. I don't know, because the best mental health conversations when I was on the clinical side were always about more than the symptoms. But yeah, I don't know. Maybe we'll be able to fool people. I think it would only work if you don't tell the patient.
Yeah, but then can you do that?
Exactly.
Ethically?
Yeah, exactly. Probably not.
Yeah.
Like that's
and then that's very confusing if you're psychotic, right?
Yeah, exactly.
And Oh yeah, think about somebody who's experiencing full-scale psychosis
And they're
something
going
their
to see an
doctor's
avatar.
getting
It's like, I'm so
replaced
sick
with
of
an
talking to
avatar.
AIs. I'm in the simulation.
Yeah.
Yeah.
I think that's actually a very good one, and it's not one that you hear often enough.
Yeah.
Hannah, what about you?
Well, I'm sort of leaning on the complete opposite in like intensivists and, you know, kind of intubating a patient and like, you know, anesthetics and, you know.
It's just so physical.
Yeah.
And high risk.
And high risk. Yeah.
Yeah.
Feels like that would be preserved.
Can you imagine the robot's first intubation? Like, would everyone be nervous about that? It's like impossible. Like for those that have never done it, it's like you're trying to lift someone's mouth and find their airway and like thread a needle down inside here.
Yeah. And you get it wrong and you're like,
you hear the saturations like going down, like boom, 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 and you're like, okay, like I'm running out of time here.
And you're seen as like the kind of, you know, the god walking into
everyone is silent,
the emergency.
and you're just like you're the one.
Yeah.
Like no one could get the airway. Everyone failed too hard. Like, you know, patients.
Bring in the intensivist. I love it. I actually have one. Pediatrics, because have you guys seen that movie Patch Adams with Robin Williams?
Yeah.
It's this lovely film, and you know, about a pediatrician who's just treating kids, very sick kids, and he's just really fun, and he blows balloons, and he brings them toys, and he sings, and he doesn't take himself too seriously.
But question, which would the kids prefer? Wouldn't the kids love seeing a robot?
In that movie, doesn't he end up not being a doctor? Yeah. I think he's not a doctor in the movie, unless I've just watched like reels and it's ruined the movie.
Yeah, maybe you're right.
Yeah,
maybe he's not a doctor.
I think like so
that makes my pick even worse.
No, it's perfect because it's like he's so good at the human part.
Maybe all doctors will have to become like Patch Adams, who was never really a doctor to begin with.
Exactly, yeah. Patch Adams and Heidi.
So patients just constantly have to guess, are you real or are you not?
What about immunology, rheumatology, like those sorts of, and then maybe endocrinology, which relates to hormones? You know, more kind of the chronic condition management area.
Yeah, but I feel like with those, and particularly like hormone management, there's a lot of sort of holistic viewpoints and like complexity and kind of data points that we miss as humans that actually I think robots and technology would be able to flag up and say, oh, actually, you know, they had their FSH done or LH done like 5 years ago, you missed it. Yeah, doesn't that influence your decision making? I feel like that complexity and kind of 360 view would be better.
Yeah, I totally agree. Because it's almost like, I don't know, like painting in the dark. Like the way we learn about these hormones, it's like there's a receptor and these receptors do a few things and there's a cycle, and it's like, well, and usually with the treatments we do is like pulsed or flat dose. And there are differences, but essentially like it's too complicated to have like some sort of like real time infusion. And then like, it's just like above our ability as humans to figure it out. It's just too complex a bucket. So we have like pretty blunt instruments, I find, with a lot of endocrinology. So I suspect it, but probably like always, it will be really amazing systems to interpret what the hell's going on. And then I still think human to explain what we should do. Oncology has already kind of gone that way. Like they test a cancer for every receptor that it may have as agonism or antagonism to different drugs, and then come up with sort of the optimal therapy. All of those specialties will have systems that support them. But yeah, again, whether I still think they'll be in the loop. I don't know.
Yeah, it's interesting. So you think about which specialties could be automated, and I think when it's a mainstream predictable path, that's well suited to automation through artificial intelligence. Where you need trust or the art or that interpersonal dynamism, I think that's probably something that remains human. I think when there's high stakes accountability and judgment is required, that probably requires a human in the loop somehow. And then I think probably predictability as well. I was thinking about that mental health scenario, and you can't encode predictability in it because it's inherently unpredictable and requires that judgment. Those are probably the dimensions that decide whether artificial intelligence will get in.
There have been studies showing that the AI is actually quite good at empathy, which, you know, that's a hard pill to swallow for a lot of physicians, because part of our argument here is that physicians will be the ones to show the patient empathy. But I've also seen a lot of pushback to those studies that I think is worth mentioning, where One great primary care physician wrote a piece for Stat News, healthcare publication, and said these studies are not fair because they compare the human physician to somebody who's only got 6 minutes for an appointment, and in the current system, half the time is in a computer taking notes. So of course the AI that isn't encumbered by that is going to feel more empathetic to the patient. A true study would give that apples to apples, where we're unencumbered and the AI is unencumbered, and who does the human like better? And I will say, as somebody who uses, I'm at the very early days of using LLMs for just to kind of test it out, for mental health. How empathetic is it? And the LLM does, these amazing chatbots will tell you that you are right and correct all the time and great and wonderful. And that certainly makes anybody feel good. But it's a true friend, and I think a very good psychiatrist or good therapist who can call you out.
Exactly. Where are the ethics lying with this, right? Because if you have a robot companion, how do you know whether it's telling you what you want to hear, which may not be the right thing or good for your health, because it knows that you like to receive information like that, versus giving you actual factually correct medical support, Yeah,
because when you're training models, there's this concept of what's your reward function? What are you optimizing for? And pretty much anything where there is a correct answer, models are really good at. So the reason they've gotten so good at coding and so good at maths is because there's an empirical correctness of how to do that thing. And it can check itself, and if it fails, it can, punish the model, adjust the weights until it gets it right, basically. The problem is there is no reward function really for someone's health. Whether I should take a chance with this patient and be kind of direct and say you're fucking up your life right now, you should stop smoking, or should I pull back and be well, I don't think I've got that relationship with them here, I'm not going to do that. Whereas I feel the chats are just trying to get thumbs up on the bottom of the message, or a positive message. So when things are subjective, it's very hard from experience to try to get the rewards right. What's the reward? Is it to help them live longer? Is it their quality of life? Is it to keep them on the chat? Is it to make them ask another question? Is it for the thumbs? What are you trying to optimize for? And I think the human reward function is very hard. As a doctor, think about all the things that go into what you decide to do for a patient. There's them, there's how much it's going to cost to society, to them personally. There's how much of a faff it is, and do you really think they need to go through this uprooting of their life? So to try to encode that into a model is quite hard, I think.
To me, that feels, of everything we've said, to me that feels the most defensible.
Yeah.
To imagine that the role of the physician in the future is somebody who tells the truth and also assesses the full spectrum of the situation around them and makes really tough judgment calls, whether or not that means delivering in some cases, very bad news. And then the right ways to deliver that bad news, the timing, all those things that the most empathetic human beings can do. I agree with you. I can't see a future where the LLM is the right answer for that.
There's been some interesting studies where they've tried to do this, almost like playing the board game Life, where you give the AI $100 and you give a doctor $100, and you actually give the doctors LLMs as well to help them with their decision making. And still today, the doctors are the best at health economics of when to investigate someone, when to delay the treatment or the investigation. And the models are just as good, if not better, at the diagnosis part. But what to do next is not something they're well optimized for.
What to do next and how to communicate.
Yeah, exactly. And to know where that person is and what the right thing to say to them is, rather than just say, yes, you are brilliant, Christina. You could be our chosen Messiah. Oh
my gosh, by the way, never have an argument with your spouse and then type it into ChatGPT because there are going to be divorces happening
You're so
globally.
Right. Cut it off.
The AI is wow. Yeah. You are so correct. Never apologize.
Cut it off. Life is short.
Best marriage advice ever. Always apologize.
I think that question of which is going to be more empathetic is actually hard to do a study design around. I had a read of some of those studies, and I think one of them used physician responses to patients on Reddit versus the LLM responses, which actually isn't what we're really talking about, a true doctor-patient consultation. And we're not trying to optimize for happy patients. We're trying to optimize for patients getting the advice and guidance they need, which might be, no, I can't re-prescribe you that narcotic or that benzodiazepine, which is why those clinician feedback ranking systems are problematic in themselves. Probably a bit more work to be done there.
All right. Well, thank you, everybody. I think we all agree that there is certainly a role for a human physician in the future, but it might take on a very different form.
Yeah, agree.
Yeah.
Appreciate it. Thanks, everyone.
Thank you.
Thanks.